So I'd like to welcome Dr. Pappaterra to this conversation with me today. And first of all, I would like her to actually tell us a little bit about her own background and how she got into hair transplant surgery. So please welcome.
Well, thank you, Dr. Farjo. Well, my name is Dr. Lisette Pappaterra. I'm from Dominican Republic. I did medical school here in the DR, and then afterwards I did my residency in Spain and also all of my degrees over there in Spain. Afterwards, I started to do hair transplant there and finished complementing with the ISHRS because of course, I believe that when you're as a doctor, when you're in a society where the stands, the qualities are assured, you get the better for it. So that's why one of the reasons why I joined the ISHRS.
Yeah, so you've been to a few meetings so far, and what is it that you actually value out of these meetings? Is it the educational content? Is it meeting people in the hallway? Is it networking?
I will say that I will say that everything. I do like the educational content because all of the doctors principalmente the ones that are in the society itself, when they do the meetings, they do try to get the most quality, or how would you say this, to make sure that you're getting the best qualities for your patients. And so I see that in the meetings, I see that in the congresses. So I do like that about the ISHRS. I also like the networking. You get to meet a lot of colleagues from a lot of countries. All of us do different types of works, and we do a combination. You get to know a lot of techniques or combinations of products to use for your patients. So I do think there's a combination on everything. I do like a lot that in all of the meetings, they always try to give the best quality of any type of topic or subject that is into it. So I think that's one of the main reasons why I usually try to do my best to go to every year to every one of the meetings, just to get the most of it for my patients.
Sure, excellent. So what about workshops? Do you have you been to any of the ISHRS sponsored workshops? Yes. And how do you feel about those?
Well, I think they even are the best because there's not so many doctors, so you get a little bit more quality with one-on-one to one of the best doctors in the area, and you get to talk to most of them, and you get to have some quality time with them. It's always, one of the things that you have to take in mind, that language is a barrier. For me, it hasn't. English is a second language here in the Dominican Republic, and also because I'm also a U.S. citizen, so I don't have problems with the English, but I do believe that some of the colleagues, maybe they don't assist to all of them because of the language barrier. So, but I do try to go to the English spoke ones, the Spanish spoke one, and I really do like the workshops. Even the best one I always love is the one in Denver, but I think it's more than 4 years or 3 they haven't done that one.
Yeah, no, I think they are planning on more, and I know Jim Harris is still very active doing, teaching and being involved with the ISHRS. So there should be more, and there are regional workshops that are planned, all over the world.
Yeah, that's true.
And
it's a shame that we can't go to all of them.
No, I know, it would be nice. It would be nice. But do you find that it's valuable to actually go and see the people who've designed the specific instruments actually demonstrating the instruments themselves?
Yes, I do believe that. Those are one of the main reasons maybe that I buy an instrument is when I see the one that they made the design or do the production of it and explain and how to use it. It makes a better reason even to buy it or to use it or to use in specific patients or not. Here in the DR, we have different type of patients with a lot of curly hair. We have all types, it's an island. So yes, I do believe that in any of those workshops or any of those meetings, to get to know the person that has done those instruments is even better. And also, I can say that it opens your mind when they also do a lot of studies that lets you know the outcomes of some types of surgery and others, And of course, in the medical degree, in all the types of alopecia, even though there's just a few that all of us knows the name, but sometimes the treatments just changes, so sometimes the way of the things goes different. So I do believe that it does help a lot to go to the workshops.
Sure. So what would you say to a doctor coming new into the field? What sort of advice would you give them? And, you know, based on your own experience of, you know, what should they do to learn to get the best training? How should they go about doing it? And why should they go about doing it that way rather than, you know, just kind of watch a video and then have a go at treating patients?
Well, I do believe that maybe, how do you say this in English? That when you get together for the best of the best, and you have the most best ideas, you get better ideas even for your own patients. Mm-hmm. But I think that for a young doctor, what the main reason has to be is, well, it's part of even medical school. You know, you have to be the best. You have to do a lot of studies. You have to train with the quality necessary for your patients. So I do believe that being part of a society that has that quality is what gonna bring you for your patients. So the main reason has to be your patients, and the main reason has to be the quality of the education that you're trying to achieve. So I do believe that being part of a group of doctors that always try to achieve the best is gonna get you to do a better quality or better performance for your patients.
Sure. Yeah, and I mean, I think that's really important at the moment to convey that message, because one of the ISHRS missions or groups and way forward at the moment is our Fight the Fight campaign, which is all about, you know, what we call the black market of hair transplant surgery. And it, you know, it's there in lots of fields of medicine, but unfortunately, we are seeing patients who are getting major complications that we shouldn't be seeing. They're getting very poor results, they're getting poor designs, and you know, it's conveyed to them on the internet that it's a very easy procedure, that it's scarless, which it is not, which is that it's minimally invasive, which it's not, that there's no complications, there's no risks to your health. And unfortunately, there are people out there, and some of them, many of them, are not medically trained. So, you know, this kind of all goes along with our Fight the Fight campaign, what you were saying about learning, teaching, and as doctors, you know, keep on learning, keep on improving our results. You know, I've been doing this for many, many years, and I still go to every single meeting because I'm carrying on learning things. Do you see where you are in your location in the Dominican Republic, patients that are going overseas and getting cheap transplants and coming back and asking you for repair work? Are you seeing these cases?
Well, that's the thing. I can't say that I've seen those patients. I do heard some of my patients telling me that one friend of them is gonna go to one of those countries outside. I haven't seen bad results. I haven't seen patients from those type of surgeries. But from here, from the Dominican Republic, we do have the same problem. There's some type of intrusivism. I think that's how you say in English, right?
Yeah.
It does occur here also with people that are not doctors that are doing the procedure, and we do see really poor results, and we do have to fix them, and we try to find the best of them. Sometimes, as a doctor, you can refuse to help that patient, but you have to take that in mind, that you have to educate your patients, educate all of the society here in the DR. Sure. I'm also part of a society here in the Dominican Republic, the aesthetic medicine, and one of the things that we're trying to do is the same, just to stop with the intrusivism, and you know, and try to do that. Any type of doctor that does aesthetic medicine has to be qualified for it. So it has to be qualified to do it also hair transplant. So those are the things that I think as a doctor, we have to make sure to be part of it and to be part of the campaign of Fight the Fight, because it doesn't only occurs in the US, it occurs in every part of the country, any part of the world. We do have those type of people that are not doctors that are doing the procedure.
Yeah.
Because they do sell it as a very easy procedure with no complication, and it does have a lot of complication for the results, and patients that are traumatized because of the results also.
Yeah, that's great. So I think you know, the big idea behind the ISHRS is the fight, the research, the education, the collegiality, and I think it's kind of got an all-rounded view to what it can offer to doctors. And it's kind of an ongoing thing. And, you know, as someone who is, you know, has been around and is kind of soon to maybe retire from the ISHRS, you know, we need people like yourself who are enthusiastic, want to get involved, and I hope to see you at the next meeting, and I hope to see you presenting or, you know, getting involved in research.
Yeah, we
papers.
have to do that. It's also a thing that doctors have to take that in mind. They have to take time for it, because we do need more, ¿cómo se dice? More outgoing on the area.
Yeah, sure. And more women. We need more women.
It's true. We're more women.
Yeah, women power. Anyway, I would like to thank you so much for speaking with me today, and getting across, hopefully, a message to some of those people out there that want to come and join the ISHRS and get involved with us.
Well, thank you. Thank you very much for the interview. I really liked it. And yes, I will try to be part of it and more into it.
Great. Lovely. All right. That's nice. Thank you so much.
Thank you.